Hello everyone, welcome back to Yunolearning. In a series on how to build upon your lexical resource in a much more effective and productive manner, we bring to you yet another video on the theme healthcare. Now let's go ahead and deconstruct the term hospital. The part of speech it hails from is noun, meaning a large medical facility, usually in a building, where injured or ill patients are provided extensive medical care and treatment. Sentence: he was admitted to the hospital after he collapsed from the shortness of breath at the stadium. Some other terms derived from hospital are hospitalize, verb that means to admit or be admitted at a hospital for treatment. Hospitalism, noun, pediatric diagnosis describing the adverse effects of prolonged stay at the hospital. Let's just simplify it. Hospitalism is nothing but the sort of effects or adverse effects, that means negative effects that a extended stay at a hospital can have at children. Hospitalist, noun, doctor who provides care for patients at hospital. Hospitalization, noun, admission to hospital for treatment. Hospice, noun, provision of palliative care for terminally ill patients. Next up, we have some types of hospitals. Number one, we have clinic, noun, health facility for treatment of outpatients where they are given medical treatment or advice. Infirmary, noun, a place in an institution for the care of the infirm, sick, or injured patients. Field hospital, noun, temporary hospital set up near a battlefield for providing emergency care. Psychiatric hospital, noun, place or institution of care of people who are mentally ill. Pharmacy, noun, a shop or hospital dispensary for selling medicinal drugs. Rehabilitation centers, noun, place where a person's ability to live or work as normally as possible after a disabling injury or illness is restored. Nursing homes, noun, facility for the residential care of elderly or disabled people. Sanatorium, noun, institution providing medical treatment and rest for patients with long term illnesses. Next up, we have some other terms from the theme healthcare. Terminal illness, noun, a fatal illness for which there is no known cure. The hospital provides palliative care for people with terminal illnesses. Mortality, noun, death used to describe the relation of deaths to the population in which they occur. Free healthcare services can slow down the mortality rate for many treatable diseases. Comorbidities, noun, illnesses associated with the illness in question. The comorbidities of obesity include diabetes, cardiovascular disease, stroke, etc. Prescription, instruction written by a physician to authorize a medicine or treatment for a patient. He forgot his prescription slip at home and hence was unable to retrieve the medicine from the pharmacy. Chronic disease, noun, a permanent disease leaving residual disability. Hypertension, diabetes, and cardiovascular diseases are three most profound chronic diseases found in the world. Intensive care, noun, advanced care provided to surgical patients with life threatening conditions. They move the infant to the neonatal intensive care unit as soon as they finish the surgery. Obesity, noun, illness defined as being 20% above or more over ideal body weight. Obesity is the major disease prevalent among children these days due to unhealthy lifestyle. Diagnosis, noun, identification of illness by examination of symptoms. The physician team summarized the symptoms for the diagnosis of the disease and issued guidelines for the treatment. Here are some questions asked in the speaking exams, IELTS exam, regarding the term healthcare. We have, what is the role of government in promoting healthcare? What more can be done to promote healthy living in your country? Do you think people should start worrying more about their health as they get older? Describe a time when you were ill. You should say when this was, what your symptoms were, how long the illness lasted, and how it affected your life at home. Let's try answering the question with the vocabulary we just learned. What is the role of government in promoting healthcare? I believe government has a significant role in promoting healthcare. Government should have initiatives that advocate and make structural changes to guide and promote healthy lifestyles among people. Government should set up free clinics where minor illnesses can be treated. They should monitor and set up pharmacies for dispensing medicines for chronic diseases and other ailments at subsidized prices so that all sections of society can afford them in order to remarkably bring down mortality rates from them. They can also allocate resources to fund and maintain nursing homes as older citizens tend to get neglected. Next up, we have a writing question asked in the IELTS exam on the theme healthcare. Some people claim that the government should provide free healthcare. Others think that this might be unjust to the hard-working taxpayers of the country. What is your opinion? Now try answering this question with the vocabulary and the words we just learned. That's all for today. For more personalized live IELTS and spoken English classes at affordable prices, enroll today. And don't forget to subscribe for more such content.